The conversation continues now on Why I Vaccinate with Dr. Hank Bernstein. He is a professor of pediatrics at Zucker School of Medicine at Hofstra Northwell and a past member of the CDC's Advisory Committee. Dr. Bernstein, welcome to the show.
Thank you for having me. I'm excited to be here to promote vaccines.
It's great to have you. And Veronica, I'm going to let you kick this segment off because you speak very, very highly of Dr. Bernstein.
Dr. Bernstein, I'm so happy to have you here for our listeners to really hear your perspective on vaccinations and the importance of them for their kids. So, how long have you been vaccinating kids?
Well, I will start with age. I'll say that I finished my residency in 1985. So we're talking about 36, 38 years.
And has your perspective on vaccination changed in those 36 to 38 years?
My perspective on vaccines hasn't changed at all. Vaccines work. Vaccines are safe. They really make all the difference in the world. What has changed is the number of vaccines that we have to protect children and adults and families, but also increasing concern that the public has as to the effectiveness of the vaccines. The vaccines work so well that a lot of the diseases that people may have experienced decades ago, such as polio or Haemophilus influenza type B, they don't see anymore. So when it's out of sight, it's out of mind. And people really wonder, do I need all of these vaccines if these diseases don't really exist anymore in the United States?
And in your practice, have you seen children with poor outcomes from illness that is vaccine preventable?
Absolutely. I wish that we didn't, but we continue to see certain diseases that continue to cause significant morbidity and mortality amongst children. And I have to say that every time I make a diagnosis of a disease that could have been prevented by a vaccine, the family always asks, could I have done something differently? And of course, it's difficult to share with them that there was a vaccine, but they had opted not to get the vaccine for their child.
So I know that we want to talk to you about flu today, but before we get there, I think it's important for our listeners to understand the life cycle of a vaccine. So can you tell our listeners about from start to finish how a vaccine gets to the market?
So obviously there is a disease. And when there's a disease and there are multiple ways of treating it, it's much more important to prevent. And preventing diseases using vaccines. And so a vaccine develops, the science is developed. It starts with an animal model. They use specific technology, specific principles. From there are different phases of the vaccine. Phases 1 is one that identifies just a safe dose in maybe 10 to 100 people. From there, it moves to phase 2, which is closer to 100 or several hundred people up to 1,000. And that's now looking at not just safety, but also the immune response. And then ultimately phase 3 trials. And the phase 3 trials are very important because they look at safety, the response, as well as how effective the vaccines are. And that those 3 things are what's most important. Once all that data has been collected, phase 3 trials are tens of thousands of people, just as we've had with the COVID vaccines. Pfizer did 40,000. Moderna did 40,000 as well, as did Janssen. They present their data to the FDA, who has an advisory committee called VRBPAC. VRBPAC reviews all of science and has a robust discussion and makes determinations on whether a vaccine should be licensed or, in this case, pandemic, authorized under emergent situation. Once that happens, It then moves to the Advisory Committee on Immunization Practices of the CDC. You're well aware. And the CDC and ACIP look not just at the science, but they also look at implementation and equity. They take into account all the clinical considerations for this vaccine that's been authorized by the FDA.
Yeah, that's really fascinating. I think it's so important for parents to understand that. I know Anne has some questions for you about the flu vaccine since it's flu season. So please, Anne.
Well, and Veronica, you asked at the beginning of this conversation, Dr. Bernstein, a very important question. And it was, how long have you been working with vaccines? And the reason that I say that's important is because his answer was 36 to 38 years. So, Dr. Bernstein, you would not be recommending either the flu vaccine or the COVID vaccine if you had any issue at all over this long, very, very successful career dealing with vaccines, correct?
Absolutely. My experience has seen much disease, much hospitalization, death in children and adults. And the idea that we can prevent these diseases is what's most exciting to me. It's vaccine preventable diseases. We ought to take full advantage by getting people, as many people as we can, vaccinated.
How do you respond to people who say, well, the influenza vaccine isn't all that effective? Some years it doesn't cover all the different kinds of flus out there, Dr. Bernstein.
So that is a common question that many people ask, and I understand that. But honestly, every year prior to the pandemic, the vaccine effectiveness of the flu vaccine was anywhere from 40 to 60%. That is so much better than 0% getting the vaccine at all. And so we know that it was effective in preventing severe disease, less hospitalizations, less intensive care unit admissions, and less deaths. When that happens, we should be happy that we're able to keep people out of the hospital and keep people dying. It's not easy to protect somebody or prevent them from getting a severe disease, a respiratory disease. When they're vaccinated, the type of disease or the quality of the disease that they get is much, much, much more mild. And we know that we want populations that don't do well when they get the flu, those that are 65 years of age and older. Children under the age of 5 are hospitalized at the same rate as senior citizens 65 and older.
Dr. Bernstein, professor of pediatrics at Zucker School of Medicine at Hofstra Northwell, and a past member of the CDC's advisory committee. Thank you for this important information today. We really appreciate it. And you've been listening to Why I Vaccinate, brought to you by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and on behalf of my co-host Veronica McNally, we hope you have a great day.